To finish up from the last video, if you're supporting the elbow with the splint, you're not supporting the wrist. Okay, moving on from splinting is, and let me say this, the areas for splinting could be the arm, could be the shoulder, elbow, humerus, forearm, wrist and hand, fingers, okay? Then it goes down to your legs. It could be a fractured femur. I said humerus, it should be humerus. Femur, it could be a knee issue, tibia, or ankle issue. The book has great pictures on how to splint that. Splint those things. And remember the 3 rules and apply them. Next one is going to be controlling bleeding. Controlling bleeding, you just apply pressure. You want to use gauze to control bleeding if we have access to it. If we bleed through, we just add more gauze. When you come up to the table, you need to read what is available to you, okay? Paper towels are usually what we have at the home, but remember that they shed fibers, and that gets into the wound and can cause infection. If we don't have anything else, we want to use a white towel to cover it, and at all else, you really just need to control the bleeding by applying pressure. Whatever you have available, you have available. Just try not to take it off, because you take off the clot when you take off the material. After you've had the bleeding controlled, remember that can be an artery or a vein. Arteries squirt blood, veins ooze blood, the color of the blood. Know that when I ask you questions on your test. Moving into wounds. We have 5 wounds to choose from: puncture, abrasion, laceration, contusion, and avulsion. Okay, the book has pictures of all that, how to cover all that. You want to make sure that you worry about infection and preventing infection. Read what creams I have up here. For wounds, you want to look at triple antibiotic to kill bacteria. How you apply that with the gauze pulled up at the corners and applying it, or you can use a Q-tip or applicator to apply it. Read hydrocortisone cream is for itching. Okay, so what it does, it stops itching. And then zinc oxide, it dries things out. So if you have a blister, you end up with, you can put zinc oxide on there to dry it up, okay? And if that blister ruptures or pops itself some kind of way, then you need to treat it as an open wound and put the, use the triple antibiotic ointment. Gloves are up here on the table. That's your first sign. First thing to use is always put on gloves. Always put on gloves. You're going to deal with someone's blood or body fluids, or might deal with their blood or their body fluids. This represents water for whatever you might need it for. Primarily with wounds, when you use peroxide or iodine, you have to rinse it with water or saline. Okay, you can't leave the dead cells in there. Peroxide and iodine kill everything. They kill the good cells and the bad cells. And you only use that at the beginning, maybe 1 or 2 times cleaning the wound. Then you don't use it anymore. Remember your 5 signs of infection, what they are. I will ask you that at some point in time. What else do we have? Okay, when you do have oozing of a wound, drainage coming out of a wound at night, like an abrasion, we've all had them, you need to use a non-adherent pad. You need to read what's on the packaging. You use a non-adherent pad because it doesn't stick to the wound, and then your sheets and socks and all that doesn't get stuck in your wound. So you need to keep it covered with a non-adherent pad to catch that drainage. Do not get the non-adherent pad confused with the gauze. What else do we have? Tape to secure anything that you might need. Gauze roll. This can be used on a securing bleeding, stopping bleeding, controlling bleeding, or on a wound. You have 2 rolls of that, and then you have, of course, a simple Band-Aid you can follow up with after you've applied the triple antibiotic. Next thing, burns. You have 1st-degree burn, 2nd-degree burn, 3rd-degree burn, also called a superficial burn, a partial thickness burn, and a full thickness burn. Okay? Burns, the major thing you're worried about is infection. Once again, you cover it. 1st-degree burns are like a sunburn. Okay? All you do is keep it cool. This can be represented by an ice pack, or you can represent it by telling the person to put cold water on there. We do not want to put greasy things on there. We don't want to put lotions on there because that'll trap the heat. So we want the burn to cool off first, and then we can worry about scarring and things of that nature. But number 1 thing is infection. Second-degree burns are going to have a blister. That's what makes them second degree. You have to have at least 2 layers of skin. You'll have a blister. You do not pop the blister because then you have an open wound. But if the blister does pop itself, you go back and treat it like an open wound with the triple antibiotic cream. If the blister is closed, you might be able to use zinc oxide on it to dry out the blister. Depending on the area and location of a second-degree burn, it might require a hospital visit. Third-degree burn is definite 911, emergency medical services, getting to a hospital. There will be flesh, there will be fat that's burned, muscle that's burned. Those are deeper, they're nasty. You cover them, cool them with cool water, cover them, get to the hospital. That is not something done and handled in the home because there's too many layers of skin involved for infection. Then we move on to, let's see, we've done wounds, burns, controlling bleeding, and splinting. If you have any other questions, refer to your book, or you can call me, text me with questions, and that's it. Thank you. Bye.